Good afternoon, Dr. Spriggs. Can you hear me?
Yes, I can. Sorry, I was a little delayed. I apologize.
It is quite all right. I'm sure at this time uh, your schedule's probably kind of packed with
And,
folks.
and to be honest, I don't understand it. I'm home. Leave me alone, kind of thing.
But I thank you for joining us and providing input on the documentary that we're working on.
Uh-huh.
So, did Gonzalez give you more information? Did he share any information?
Very top line.
Okay, so what we started to do, so my friend and I, who he's a director and I'm a writer producer, we've been working on a lot of different projects over the past 30 years. He still drives transit in New York.
Mm-hmm.
And so as this shutdown started in New York and things, of course, New York is the epicenter. And so he's started finding out that they didn't want the bus drivers to have face masks. And so there
Mm.
were a lot of issues going on with that. And of course, then bus drivers was contracting COVID and nothing seemed to have been changing in their policy as far as gloves and face masks was concerned. Some of his co-workers who are transit workers have spouses that are nurses in some of the hospitals. And we started getting that feedback as well. One of the gentlemen that drove one of the buses, his wife was a nurse, had just was hired with a hospital. And I guess there's a 90-day wait for insurance.
Mm.
And
Mm.
so they put her in ICU over COVID patients, and she contracted it. And they told her that she wasn't eligible for insurance to cover her treatment. And they sent her to a different hospital. And then her husband, who's the transit worker, found out he had it. So these were the different stories that we were just hearing in general. And so we really wanted to put a documentary together that would kind of expose these inequalities, the impacts that they're having on everyday people, and the stories that are not making it to CNN and some of the other channels.
Right.
So I saw a lot of different uh, advertisements on Facebook, and the AFL-CIO came up several times
Mm-hmm.
for different information, and that's how I reached out to them, and he was able to give me information on you.
Okay.
So one of the biggest questions, I guess, now with your background,
Mm.
as far as working with labor and the economy, what is the biggest thing that you're seeing now that's challenging as far as essential workers, union workers right now with the
Mm.
pandemic?
Well, there are several challenges. They're running together. One uh, is the importance of safety at work, and the missing element in this is we lack a national plan to get the disease under total control. What we put in place was a fourth of a plan that dealt with the issue of leveling the disease so that it wouldn't stress the capacity of our hospital system. I think we can say so far, because the number of new cases and deaths is leveled, and except for a few hot spots, we've achieved not overrunning our hospitals. That's it. That's the other three-fourths of the plan that are missing are now the problems faced by workers. Continued safety at health, it's continued safety and health at work dominates because we can't address the ramifications of the other three elements of the plan that were never implemented without getting the disease under control. So one plan needed to be, if you can level off the disease, can you then begin to increase testing, do better tracing, and then start to isolate and track the virus and how it's spreading? Now, that's necessary because without that information, you can't you can't defeat the virus. And I point out to people, we got attacked as a nation 9/11. Americans were willing to sell their souls, give up on American values so that we could torture people in order to get information. We felt American values don't have anything to do with this anymore. We thought the terrorists were so bad, we shouldn't play by their rules. And John McCain, who had been a prisoner of war and had been tortured, said, no, do not do that. This set of values is too important. If you lower yourself to the level of the enemy, this is bad. Now we're fighting a virus, not human beings, a virus. It's not a cockroach. It's not a mosquito. It's a virus. And are we doing our best to get information? Where is the virus? How can we locate it? How can we isolate it? Right? I mean, this is like common sense. How can you stop something you don't even know where it is?
Exactly.
So number one, well, the number two part of the plan that never got implemented was you need information. And here it shows up at work in tragic ways and related to race, or if it's not related to race, the incompetence to pursue the data plays to anyone who believes that no one's that stupid and wouldn't do this unless it was deliberate. Right? You sometimes competent people make mistakes, but when they make a mistake that's huge, you figure that wasn't a mistake, because only a stupid person would make a mistake that bad. So Nebraska, the other day, the governor says, we will no longer report on the outbreak of the virus in our meat packing plants. I'm trying to locate an enemy that is killing people. And you tell me I'm going to harbor the enemy. I'm not giving you any information on where the enemy is located. I will not tell you how to find it.
Wow.
If he were saying, I know I have terrorists in my state, and I don't care, y'all won't find out about it. I'm not giving you any information on it. I know they're plotting. I know they're killing people. I don't care. This is not relevant. I don't care. You're not getting the information. Wouldn't we all be saying, what? But this is a virus. It's not even human beings. You're not denying somebody liberty or rights. You're telling me where is a virus. I'm not asking you to spy on a person. I'm not asking you to go sneak in their bedroom. I'm not asking you for their political religion. It's a virus. I'm asking you, where is the virus? And you tell me, no. I'm not telling you. I'm not going to tell you that. The CDC 2 weeks ago put out a report on the virus in meat packing plants. And they reported where the incidents had occurred, but in that report was a very telling set of paragraphs that said, these are the only meat packing plants in the only states that reported to us by industry and by occupation. So when we're telling you about meat packing plants and how the disease spreads in meat packing plants, that's because these are the only ones that we have information on. If there were terrorists letting bombs go in every city in America, killing hundreds of people, and you tell me, well, yeah, but you know, the mayors, the governors, they're not cooperating. They're only telling me where 10 of the terrorists are, and the other 1,000, they're just blowing up people. I mean, you know, hey, you'd go after the generals. You would say, how can you not find this information? How come it's not mandated? How come you're not doing this? Dimension-wise, we've lost over 80,000 Americans, 83,000 Americans is the current count. The combined deaths in combat in Vietnam and Korea, that was over years, was 83,000. What is it? 80,000 plus some. Healthcare workers on the front line fighting this disease are dying every day. We know that about a third, if not a different number, but maybe a third of the total deaths are people who were exposed in the healthcare setting as workers in some form. Orderlies, nurses, doctors. So this, people resist it because they have their own image of soldiers. They have their own image of risk. But we've lost more people in healthcare to this virus than the combat deaths in Korea. These workers, this is not hyperbole. This is reality. These workers' lives are on the line. They are dying every day. If you have no human compassion, okay, fine, I got it. You're just, hopeless. But if you're a person of compassion, and if you care about your country, if you care about yourself, if you care about whether humans make it through this, you got to care about the people who are dying trying to fight this virus. And when someone says to me, I don't care about meat packers, then I look at the data. Who are meat packers? They are overwhelmingly black, brown, and yellow. So when you tell me, I'm not going to tell you where the disease is that's killing people who are black, brown, and yellow, I begin to be suspicious. I'm sorry, but I begin to be suspicious. You're not telling me you don't care about the people who are dying. You don't think this is your problem. This is somebody's problem you don't care about. And again, it's the dimensions. It's not 2 people. It's not 3 people. We're talking about thousands of people. We're talking about every day we lose almost what we did to 9/11. If 9/11 bothered you, this has to have you through the roof, that no one has a plan to kill the virus. And when we see the data that the CDC released about the meat packers, and the week before they did healthcare workers, and the same thing shows up. We only have some states that let us know that healthcare workers die. Now, everybody knows from the data, from the stories, in the media, as a global phenomenon, because healthcare workers are directly fighting the virus, and people who are infected, they have been getting the virus, and it has been killing them. This is a global phenomenon. This is known. If I want to find the virus, wouldn't I insist every hospital has to be reporting to me who got ill, what was their job, so I can understand their interaction with potential patients, so I can understand what exposure they might have had, and who might need extra protection, because we talk about the masks and we talk about the shield protection, and we see hospital workers who enter the wards where the fight is going on. But when the patient first comes in, see, we don't see those workers. So that person who's there to greet them at emergency and do the intake, we don't see what protection do those workers have. It's all well and good after you tell me, oh, the person has it, then now I move you to a ward where everybody's protected. What about those workers?
Yeah.
I have to have the data on that. And again, you would think I'm asking you for something super personal, or I'm violating some human's right to information that shouldn't be revealed about them. But I'm fighting a virus. I need to know who got the disease. How did they get it? So how can I prevent it? And anyone who's a scientist, the first thing a scientist is going to tell you is, where's the data? You want me to solve a problem with no data? Then that's not science. You just want me to be, hokey pokey, wave my hands. I have to have data. If you limit my data, you limit my understanding of the problem I'm trying to solve. So this is the second part that has everybody just dumbfounded. And yet we know that these frontline workers in health aren't the only ones, because of the peculiar nature of this disease. People are asymptomatic at the time they are the most likely to infect other people. And because we didn't do the proper testing in the beginning, it meant many people were walking around who were infected who didn't know it, but were also the most likely to infect people. And again, I'd want data on those sets of workers who are in the public the most and encounter the public the most as the normal course of their work. We didn't collect it, but we know what those workers look like. They're disproportionately Black and brown. They're disproportionately female. So it's frustrating. It's frustrating because it stretches credulity for me to think you care, that you are trying to solve a problem, when the most obvious, basic ABC 1, 2, 3 level basic steps aren't being taken. Step number 3 is, you knew back in January, because you could watch China, South Korea, Italy, as the disease progressed, they had to confront that they were behind the curve. So they had to stop everybody, say, stand still, please, because moving about, you're going to spread the disease, and we need everybody to stand still so at least we can get a handle on it. Now, knowing that's true, what's your plan? Because if I say, and we saw this, right? Italy said, we're not going to play soccer, which is, in the US, we're going to end sports like we did. So you saw that was necessarily in Italy. Didn't somebody say, oh, so we're going to cancel the rest of the basketball season, the rest of the hockey season, like Italy did? Didn't somebody in the room raise their hand and say, well, that's a lot of workers, because there are a lot of people who work in those arenas. What are you going to do with them? And then when you saw Italy say, well, it's even necessary that we don't have more than 10 people, because get more than 10 people get together, it spreads, it'll get out of hand. And then someone says, well, you should shut restaurants. Didn't somebody raise their hand and say, restaurants employ 12.6 million Americans, 12.6 million. That's the size of the entire manufacturing workforce of the United States.
Wow.
Shouldn't somebody have raised their hand and say, okay, totally get it. I understand it. If we let the disease spread, who knows what will happen? Got it. But since that's what you want to do, what are you going to do with the 12.6 million people you just said you don't want to work? Nobody raised their hand. In January, somebody needed to raise their hand and say, is there a plan for that? How are you going to handle it? it's mind-numbing. So now the problem is the initial failure to plan on part 2, which is find the disease, hunt the disease, kill the disease. Part 3 was my idea that we need to be safe. Everybody agrees to it, but nobody thought about the economic implications. Disproportionately, the early filers for unemployment insurance we knew were women because they predominate in those services that were targeted. Restaurant work, hotels closed down, accommodation work, personal service work, beauty shops, child care, personal services like doctor's offices, dentist offices. Those were the early sets of job losses. But after those happen, without a plan, with no plan, go to the unemployment office, which in the United States is not a plan. You know, if I'm grading my students, that's the F answer. That's like well, I said write a plan. Don't pray. Pray. I'm always in favor of prayer, but you have a responsibility to God. You can't say, God, you know, I'm just going to pray it through. You got to do something too. You got to do the obvious thing. So telling me I'm going to put people in the unemployment insurance system, that's not a plan. Now, fortunately, Congress reacted to that and put in place a lot of things to fix why that was a stupid idea in the United States, because the unemployment insurance system in the United States is a punitive system. It's designed to punish workers because we want them to work. It's not designed for, I know I need people to stop work. I want them to stop work. And so I'm not trying to hurt anyone. I'm not trying to do that. I just need to park them somewhere while we handle this crisis. If that's what you want to do, you don't put them in unemployment. Congress understood all the things that were wrong with our unemployment system after this failure on the part of our president to come up with a plan. And Congress stepped in to say, well, have you looked at unemployment benefits? You're not parking the people. You're trying to starve them to death. They're getting a third of their regular pay. That's not paying the rent.
No.
So Congress stepped in, increased the benefits, and then because our system is punitive, low-income people have no access to the unemployment insurance system because it's designed only to reward full-time, sort of medium wage workers or better. So if you are a regular full employee as a part of the wait staff at a restaurant, you normally do not qualify for unemployment, even though you show up to work 50 weeks a year because your earnings are too low.
Wow.
So Congress understood, well, you keep telling a bunch of waitresses you're unemployed is not an answer. So we had to fix the unemployment insurance system so they would have access to the unemployment insurance system. In a regular economy, fewer than 17% of unemployed people get an unemployment check. In the restaurant industry, fewer than 8% of unemployed restaurant workers get an unemployment check. So this is why I'm saying your answer is they become unemployed, so I put them in that system. It's like the system doesn't reach anybody. It does. 8% of people, you're going to tell 12.6 million people in an industry where fewer than 8% of the people get an unemployment check if they're unemployed. That's where I'm putting you. That's not an answer. That's not a plan. So here we are trying to fix that part of the economic problem. But then the economic problem quickly becomes a regular recession. And by regular recession, I mean there's not enough demand. And so people stop doing certain things, like buying cars. And part of people weren't buying cars was emotional, because the anxiety that this disease is creating is huge. And it's not like you wake up every morning going, man, I want a really new car. It's not first thing on your mind. And then the requirement of social distancing meant that those who could telework were asked, please telework. So I'm not reminded every day that I'm driving a clunker because I'm not driving. So, again, a car is just not on my mind. Then we were confronted with the United Auto Workers who were going to work while other people were teleworking. And it occurs to them, I'm standing awfully close to somebody to make a car, and I don't know if they have the disease. I don't have protection. I don't have a mask. I don't have anything to protect me from the disease. We're sharing, putting together parts. I mean, we're wearing gloves, but we're going to take the gloves off and we're close to, I mean, what is protecting me? And then, as we know, Detroit became a hotspot.
Yeah.
So for a brief time, the plants had to shut down because the workers and management had to work out these safety issues. And then they were confronted with what we have now, which is nobody's buying a car. And then that creates the normal type of recession. There are suppliers who make the parts that get assembled. If you're not assembling the car, I don't need the parts. I don't need to hire you. So in April, when we lost 20 million jobs, about 7 or 8 million were the ones we said we don't want restaurants, we don't want people in movie theaters, we don't want people selling beer and popcorn at a stadium, we don't want childcare, we don't want beauty parlors, we want all of that to stop so we don't get a lot of people together. So about 7, 8 million of the job loss was that, disproportionately falling on women. The job loss was greater for women by percentages than for men. But then we had losses in manufacturing and construction related to the economic forces. Now we have a problem because now we're in the phase where it's going to start to look like a regular recession where there's inadequate demand. We lost 20 million jobs, but there were 10 million workers who suffered a loss in pay because they were cut from full-time to part-time. So 20 million people don't have a job. Another 10 million took a cut in pay. That's 30 million people who are in economic stress. Then we complicated things because it was a disproportionate job loss for women, but at the same time, we shut down our school system during a regular school year period. And so particularly for Black women, they lose their job, they come home, but they're almost filled with kids. And what do I do? And particularly if you're a single woman who's heading a household, it's not like you can share the duty of what to do with this kid or kids. So the drop in labor force participation for women has been quite severe. So the unemployment rate for women, this is just an arithmetic thing with economists and how we think about unemployment, but the drop in labor force participation rate for women was fairly severe because we had closed the schools and someone had to take care of the kids who were now at home. And so the unemployment rate for women didn't go up as high, as much percentage-wise as it did for men, but the joblessness, not having a job, went up more for